ACL or the anterocruciate ligament of the knee joint is a very important ligament of the knee joint, and it usually gets torn in sports injury or in our country because of road traffic accidents. Now, once the ACL gets torn, then the knee becomes unstable. The patient doesn't feel confidence in his knee joint, and sometimes what happens because of this lack of confidence, the patient can have a fall, or because of recurrent instability, it causes further damage inside the knee joint. So the ACL ligaments once torn usually requires reconstruction, especially in young persons. This reconstruction procedure is done by arthroscopy only, though initially open surgeries were done. But nowadays the gold standard of management of ACL injury is arthroscopic surgery, where we make two small holes to reconstruct the new ligament. So arthroscopy is the best technique for management of ACL injuries. So shoulder arthroscopy is usually performed for either recurrent shoulder instability or recurrent shoulder dislocation that happens in young persons. In slightly elder persons, it is usually performed for rotator cuff tears, where the rotator cuff, which is the most important part of the shoulder joint, it gets torn and it has to be repaired. So these two are the commonest indication for shoulder arthroscopy is performed. Shoulder arthroscopy is usually a very safe procedure because it is a keyhole surgery, so the chances of infections are very less. Now, the complications which you can have after shoulder arthroscopy, especially if you are doing rotator cuff repair, is that it can lead to stiffness of the shoulder joint, because once you have repaired the rotator cuff, then you have to protect your repair. So in that case, you don't allow the patient to take the shoulder through full range of motion. So if you don't allow them, then shoulder sometimes becomes stiff. But even that complication is not very common. We hardly see them in 5 to 10% of patients who have undergone shoulder arthroscopy.